Welcome back. Here with us on Mirror Now. The debate around booster shots is back with Omicron spreading fast in the country. There are already 21 cases in India, and today the National Technical Advisory Group on Immunization had a meeting to discuss the way forward on India's booster policy. What should be India's strategy? Let's discuss with a leading expert in the field, a very well-known face. We are joined by, in fact, Biocon's Kiran Mazumdar Shaw to understand how should be India's booster policy. Ma'am, thank you very much for joining us here on Mirror Now. There are about 21 cases of Omicron variant in India already. The number is going up. Do you think India should now seriously consider administering a booster shot?
So I'd like to answer that question in two ways. I think we must understand that the Omicron virus is a very different mutant to the Delta and the previous, variants. And I think you have been reading that the vaccines are not exactly working against the Omicron virus. In fact, many of the vaccine producers have indicated that there could be immune escape because of the mutations on the Omicron virus. Now, if you were to consider that, then I would rather wait for an efficacious vaccine or an antibody cocktail that could actually attack this new variant. On the other hand, boosters are very important because we have seen antibodies waning in many of the vaccinated people. And we do know that there is some extent of cross-reactivity. So to that extent, I think boosters are very useful, especially to frontline workers, healthcare workers, and to the elderly who actually have very weak, immune responses to the vaccines in the first place. So that's the way I would look at it.
But Ms. Shaw, we know that a lot is also going to depend upon the availability of vaccines. In the past, we have seen that how vaccine availability has helped India draw its vaccine strategy. So what should be the top priority? What should be the right way forward? What is your suggestion to the government? The people who need it the most, the health workers who got it in January this year, or the people who are still unvaccinated? Who should receive the first set of booster dose that we're talking about?
First and foremost, I want to tell you that there is enough vaccine adequacy. So it's not that we are short of vaccines. In fact, I'm told that now the procurement of the government is almost coming to an end. So I think the government needs to reorder vaccines because we do need to make sure that everyone who hasn't yet taken a second shot should take the second shot. And secondly, I think booster shots are going to be very important. Like you said, many people have taken it in January and February, and they certainly are eligible for a booster shot. And booster shots are going to be important because we are seeing waning levels of antibodies. I think from that point of view, I think the government ought to procure more vaccines, and there's no, as I said, there's no inadequacy of vaccines anymore. In fact, I think vaccines are now being stockpiled at the vaccine makers' end. So I think rather than, and the government has also not really opened up the floodgates when it comes to exports. So I think from that point of view, I think you do need to start, allowing booster shots.
Now, Ms. Shaw, the kind of statements that have come recently, on the issue of this booster shot or a policy on booster shot, for example, from INSACOG, which is Genomic Consortium, suggested that, there is a need to provide booster shot to people who have high risk. And then later a clarification came in which it was mentioned that it was just an internal discussion, nothing of a recommendation, really. What do you make of the kind of statements that we've got so far? Do you think the government is really keen to have a booster policy soon, or is it still in a wait and watch mode?
No, I think the government is certainly looking at a booster policy, and I think they are looking at it in a very pragmatic way. They do know that you need booster shots. I think they're just trying to stratify the population in terms of who gets it first. And I think that's the right approach. But I think we do need booster shots because we are seeing the world over. And remember, this is a pandemic where vaccines have been developed very rapidly. So we really are sort of learning as the pandemic evolves. And therefore, I think the booster shot is certainly something which we need at this stage. So I think the government does need to start procuring vaccines as a booster shot.
And ma'am, there's another debate about vaccinating the children. I was looking at some data between 2 to 17 years. The population that we have right now is about 44 crores that we have. That's unvaccinated and vulnerable. What should be the right way forward as far as vaccinating children in India is concerned?
So I think anyone over 12 should be vaccinated quite safely. It's really the kids below 12 years old that need to be looked at very differently, because the full dose is safe for young kids. We also know that there are now in other parts of the world antibody cocktails or antibody preparations that are considered to be very safe for very young kids below the age of 5. So there's a lot of that discussion going on, but we also know that young children really don't, develop any severe disease to the extent that the elderly and the adult population develops. So I think we have to look at all this in a very analyzed perspective. I think analysis and generating data is going to be very important to come to the right decision.
And for children also, even if the government decides that we are ready to administer vaccine doses to the children in India who are vulnerable specifically, where are the vaccines really? Because one got permission, but then we don't know how soon that will be used to give to the children.
You must remember that there are ongoing trials, and I think you should also look at the various vaccines that are being used in different parts of the world in terms of children. But as I said, there is no shortage of vaccines in India. I think the main thing is, when do we give the vaccines to young children and what vaccine should we give? If the world finds that a certain vaccine is very safe to administer to very young children, we should try and procure those vaccines if we don't already have it in our country. But I, for one, believe that we should, start looking at populations over the age of 12 and not, restrict it to 17 and below. Because let's not forget that 12 to 17 are almost getting into adulthood. So I don't think we should worry about that population.
So, Ms. Shaw, are you then trying to say that we should ideally look at children below the age of 12? That should be our first priority?
No, I'm saying if you are thinking about vaccinating children, right now you're talking about anyone below the age of 17 being classified under that category. I'm saying we should reduce that age level to 12, because above 12, you should be able to vaccinate everyone with the existing vaccines.
That's very interesting. And Ms. Shaw, I also want to know your view on India's vaccination drive so far. The latest data from the Ministry of Health has suggested that India has administered about 127.9 crore vaccine doses. Of course, it picked up pace recently. But what will you say about the drive so far and the approach?
I think it's been excellent. I think we should actually pat ourselves on the back that we've been able to vaccinate such a large number of people in our country. I think, yes, the vaccination, sort of process slowed down after we saw the Delta variant kind of waning away. But now the Omicron virus has certainly brought back the focus on vaccinating. And I think we should try and vaccinate all our population with the second dose. And then get on to booster doses simultaneously as well, because I think that's what we now need to focus on.
And as you mentioned, Omicron as the threat we're all facing across the world, what do you think about the kind of restrictions that are in place at this point? Do you think that's the right approach? Because, some state governments have come forward and said that we should completely ban flights from countries at risk, but then virus keeps on mutating. What's your point of view?
So whilst we should be very vigilant and careful and cautious, I don't think we should be paranoid and, create chaos with this paranoia. For instance, I don't think we've been in a state of preparedness as we script out new protocols. Now, you can't ban flights and hope that the virus will stay away from India. because that is a bit, naive to think so. I think we must understand that today we live in a world that is interconnected and travel does spread the virus. As you know, the world tried to prevent the Delta virus for a long time, but today the predominant strain is the Delta strain. Now you've got Omicron, which is replacing Delta, and this is the law of nature. This is what happens to a virus. It keeps evolving, and the old mutant gets replaced by the new mutant, because that's the job of the virus, to keep mutating and finding new ways of infecting rapidly. But also we should remember that normally nature has designed the viral mutations in such a way that they keep weakening, because they really want to build a homeostasis with the host. They don't want to kill the host. They want to basically infect and keep thriving on the host. So hopefully the Omicron virus will be a milder version of the Delta virus. But having said that, we have no definitive data to show that it is indeed milder. So we have to be vigilant. I don't say no. We must test, we must quarantine, but we can't ban flights. And I personally believe that, look, what is happening at airports is creating kind of transmission zones by telling people to wait till the tests come out. We do have Arogya Setu as a very, very good app. If we just take swabs of these arriving passengers and make sure that they quarantine till the test is announced, we can actually track them down and tell them if they need to report to a hospital or an institutional quarantine center. But to simply keep them cooped up in an enclosed space, which is not what airports are designed for, is not very reasonable and very advisable.
That's a very pertinent point that you're making, Ms. Shaw, and I've spoken to you several times in the past as well, and you seem very vocal about how India needs to now put more funds as far as the research in science is concerned. Lots of lessons, I'm sure, have been learned in this pandemic. Budget is coming. What do you think the focus really of the government should be?
I am very keen that the government announces research-linked incentives. I think we have unleashed the research capabilities of India, India Inc., the government laboratories. And I think we need to really start incentivizing research in a big way. I think that's the only thing that will deliver non-linear, sustainable economic growth for the country. If you don't do that, you will just have incremental growth, whereas what we need to really break free is exponential growth, and that can only come through research. We need to actually embrace innovation, invention, and research in a very strong way, and it's not going to happen without incentive.
And last question before we let you go. It's been over 20 months. How was the COVID time really for you? And what do you expect the next year, 2022, to look like? What are your expectations?
See, I am very optimistic because I really believe that over the last 2 years, we have actually developed a huge understanding of the pandemic, the virus, and we have developed a large number of vaccines and therapeutics that can combat the virus. So I think we are in a much better position. And by next year, I think we shouldn't at all feel worried about this virus. I think we should be in a state of confidence that whoever gets infected, we know how to deal with it. And we know how to vaccinate people, we know how to treat people, and we won't have any deaths to worry about.
Thank you very much, Ms. Kiran Mazumdar Shaw, for speaking with us exclusively here on Mirror Now, and some very interesting suggestions you have given as well. We'll see how the government really responds to this entire debate around the booster policy and who is going to be the top priority. Thank you very much, ma'am, for joining us here on Mirror Now. Moving on, with the state of Karnataka having mandated double-dose vaccine for entry into public places such as theatres, malls, the capital city of Bengaluru has witnessed a surge in vaccination. Several residents lined up at a healthcare centre to take their dose of COVID vaccine. Take a look at this report.
Several vaccination centres across across the state of Karnataka were wearing a deserted look, but things have changed after the detection of the 2 Omicron cases and also the new rules that have been imposed by the government mandating that anybody entering malls, cinema, theatres or even shopping complexes will have to have their double dose of vaccination completed. And now we're looking at vaccination centres once again brimming with activity. A lot of people turning up. Even on a working day, you can see quite a number of people who've come to this particular vaccination centre. The government, of course, had said that lakhs of people, of course, were overdue for their second dose, hadn't taken it. And now with the new rules that have come forth and also with the fear of an impending third wave, coming to the fore, it looks like people are once again visiting these vaccination centers, ensuring that they get their jab, and the health workers as well are quite happy to give them their jab, both the first and of course the second one. At this point in time, even the doctors have been specifically mentioning that the only way to fight even the new variant would be to aggressively go ahead with the vaccination drives and ensure that everyone in the state is fully vaccinated.
And with this, we will slip into a very, very short break. But on the other side, we'll talk about another very important issue, and that is about the children of this country. Should India now consider vaccinating the kids? With the number of Omicron cases rising, Omicron has impacted kids as well, especially in South Africa. That's the big debate coming up for you on the other side. Stay with us.